Healthcare is evolving, and with that, the patient's needs, wants, and behaviors are evolving. But here's the question: are we? Are we as providers evolving with it? Today's patients enter our clinics armed with information, Googling symptoms, comparing treatment options, price checking mid-consult, even questioning our recommendations despite our training and expertise. Yet, in this digital era, we were never trained to adapt to these shifts in patient expectations and decision-making. And still, we're expected to navigate these challenges without ever being taught how. As providers, we were trained in evidence-based sciences, how to select protocols, interpret diagnostics, and apply treatment options to maximize outcomes. But no one trained us on how to manage today's patient. The one who hesitates to seek care, who resists treatment plans, or sees us not just as experts, but just another voice they need to verify. Healthcare is no longer solely in the hands of providers. Patients are bombarded with conflicting information, social media, online research, and direct-to-consumer marketing in some countries, fueling confusion, skepticism, before they even step into our offices. The trust crisis in healthcare is real, and the gap is widening. Not because patients don't trust us, but because they don't know who to trust anymore. And the result? Delayed decisions, doctor shopping, not adherence to treatment. And if we look deeper, we see a system riddled with inefficiencies. Patients living with unmanaged chronic conditions, delaying critical treatments, and experiencing worsening health outcomes. And all the while, our providers unable to practice at their full potential. Yet while patient behavior has evolved, the way we communicate has not. We've been trained to educate, believing that if we provide enough information, patients would make the right choices. But today, decision-making is driven by perception, emotion, and cognitive biases, creating invisible barriers in how patients engage with us. This disconnect, the gap between how we were trained to communicate and how patients actually process information, is fueling frustration, fatigue, and burnout for providers across the world. I know this firsthand. Like many providers, I once believed that clinical knowledge and thorough explanations, it's enough. But over time, I realized that expertise alone wasn't enough to influence today's patients. Trust had to come first. Patients needed to feel my recommendations were in their best interest before they would act. Determined to find a better way and bring ease and flow into my consults, I studied the key drivers of patient decision-making. I tested different approaches in my own practice, refining strategies that not only transformed my patient interactions, but led to a federal recognition in the US for excellence in patient-centered care. When the opportunity arose, I expanded my work globally, training providers across India and Asia Pacific in some of the most competitive healthcare environments in the world. And no matter where I went, the struggle was the same. Providers feeling frustrated, exhausted, and questioning why patients wouldn't follow through on treatment. No matter where I worked, I saw the same disconnect between what patients truly need from clinical communications and how we as providers were trained to engage with them. But I also knew this: if I had struggled, adapted, and ultimately thrived, others could too. But my goal wasn't just to help an individual provider in a country. I wanted to create something bigger, a solution that just wasn't effective in my own practice, but proven adaptable and scalable across every healthcare setting. A structured approach that any provider in any specialty could seamlessly apply, eliminating years of trial and uncertainty I once faced and that so many are still struggling through today. Because I truly believe providers deserve better tools, better strategies, and I was determined to create that on a global scale. This realization led me to create True and Trusted, a company built on beliefs that providers shouldn't have to struggle into influencing their patients into better health. We've scored the science around the key variables behind how patients make decisions and turned it into a structured, adaptable method that any provider can use to achieve better outcomes for patients and their practice. In today's healthcare landscape, clinical expertise alone is no longer enough. Providers must master a new level of communication, one that is strategic, intentional, and deliberately aligned with how patients think, process information, and make decisions. The real challenge isn't a lack of knowledge, it's that our communication methods haven't evolved to match the way patients engage with care. At True and Trusted, we redefine clinical communications, giving providers the advantage they need in today's healthcare landscape. We train providers to apply neuro-linguistic communication, a science-backed approach grounded in applied cognitive and behavioral sciences, behavioral psychology, neurolinguistics, and decision science, giving them the tools to navigate their daily patient interactions with clarity, confidence, and impact. Because if there's one thing that I've learned in healthcare, it's this. It's not just about what we say, it's about how we say it, and how it's received, and how that drives action. At T&T, we believe providers deserve solutions that are practical, proven, and easy to implement. We're not here to add to their workload. I'd hate that. Instead, we offer proven tools that providers can seamlessly integrate into their practice, allowing them to overcome the very challenges they face every day. It's about moving beyond outdated communication models. It's about reshaping how we guide conversations, reducing patient resistance, and improving adherence without the frustration, the doubt, or the exhaustion. Because when we refine how we communicate, our words, our tone, our delivery, everything changes. Patients become more receptive, consults feel effortless, and clinical success becomes not just possible, but predictable. Every provider has felt it. Patient conversations that should be straightforward, yet somehow they feel like an uphill battle. But the reality is clear. If we don't evolve how we communicate, we risk more than just difficult consults. We risk losing patient trust, seeing treatment plans dismissed, and watching health outcomes decline, not because of our clinical expertise, but because of how disconnected traditional communication has become from patient decision-making. But when we learn to guide conversations with precision, when we mastered the ability to connect, to influence, and to build trust at a deeper level, everything shifts. At T&T, we're not just improving consults, we're redefining patient care, one conversation at a time. We're building true and trusted providers who will lead the change in healthcare transformation.